Good evening, students. Today I'll have case study presentation presented by Akash. Okay.
Hi everyone. Today I am going to present a case which I seen in my clinical visit, and today I am going to tell a case about a 62 years old man visited the clinic for a stroke case. He was affected with right side stroke, that is left side hemiplegia, left side brain hemiplegic, left side brain lesion and right side hemiplegic, and he was gone for a flexion deformity. And now I learned how to assess and treat a patient with a stroke. First, we want to assess with both subjective and objective assessment. In subjective assessment, we asked about his personal details like name, outpatient number, mobile number, address, and everything. And after that, we asked about past medical history, which he was affected with later cases or any surgeries he gone through, and present medical history and chief complaint, what he was complaining of, like not doing functional activities or affected with shoulder movement disorder. So like that he will complain of. And in medical history, what drugs she is taking for the stroke condition, and socioeconomic history and family history, whether the family member is affected with the same conditions or any other conditions like diabetes, hypertension, so that he was gone through the stroke. Then we will go for objective assessment. Here we assess on palpation, on observation, and on examination. On observation, we will see his gait, and he was affected with circumflexion gait, that he walks with foot like abducted and circumflex and keep in front because of his hip flexor weakness. And then he didn't wear any external appliances. Then his posture was deviated, that he gone for flexion synergy. Next, we will go for palpation. So muscle was so spastic. He is in spastic condition. So in the stroke, we will assess a condition with Brunstrom classification. First, he will go for placidity when he was affected with stroke. Then he progressed to spasticity, and spasticity developed to synergy like flexor or extensor synergy, like decorticate or decelerate. And then he will slowly reduce his spasticity. Like last stage, he will recover from spasticity. So now he was in spastic condition. Next, range of motion, muscle tone, these all we will assess. So he has a reduced range of motion and increased muscle tone, hypertonicity, that is spasticity. Then we will check for a pain grade. Next, manage. First, we can take in diagnosis. He was diagnosed with right side, left side lesion in a MRI report, and he was taking a treatment in a hospital, and now he was referred to a physiotherapy management. In PT management, we will go for a quick icing to reduce his spasticity from distal to proximal, and we will go for minor stretching activities. After his spasticity, if he was bedridden, we want to treat with bed shows and mat activities to prevent other joint motions and bed shows. Next, we can go for mild stretching, passive movements for lower limb especially, and also for upper limb. Electrical stimulation for gait correction, that patient therapist supports his leg with patient's leg, and try to walk with without abduction with the hip flexion, and there's postural corrections and weight shifting activities in his hand. When he go for flexor synergies, he will keep his hand in a flexion position, so we can get into a stretched condition and keep wrist in a stable table, and we can give weight shifting activities for that flexor synergy correction, and same as for lower limb for weight shifting activities for correcting the deformities. Then pain reduction and so on will go for the PT management. Thank you.
Good evening, students. Today I'll see about the stroke condition. In stroke condition, your management is what is the approach is needed? passive movement is nothing old traditional method. But now is you go for MRP program, motor relating program. Okay, so this concept is based on hierarchical theory. Okay, so brain is absence of the particular structure. Motor cortex structure is absent of particular region. Motor movement is terminal tract lesion. Okay, that is the recollect the information about patient own task, then achieve this task, then will move for repeated task. Okay, that is a MRP program, motor relearning program. Okay, that is completely for active, completely active perform. Okay, just first we will go for in this case right side imparalysis. Okay, right side movement is impaired. Okay, you will teach about minimally, you will touch the pen. So minimally, in case you support the hand, touch to the hand. Okay, this was trunk forward flexion and the shoulder flexion. Okay, then in case adduction, same, we keep the hand position. So hand keep the position is the palm aspect. This palm aspect. Okay, then we'll go for abduction training. Okay, then you will go for weight bearing training. Weight bearing is mainly for both this hand is keep the bed. Then you will go for elbow in straight position. Okay, then you will move for the both full weight and the opposite side. So this exercise is mainly useful for proprioceptors activated. Okay, in this weight bearing position, the joint proprioceptors will be activated. Okay, then once the proprioceptor is activated, then regain the muscle strength. Okay, then we will go for trunk training. Okay, in trunk training we will go for same, hold the hand forward, then we will go for trunk is forward, then touch my hand. Okay. So in this patient you have to support the stabilize trunk. Okay, trunk stabilize pannite hold this one. Front. Okay, then backward. Okay, then the repeated for 10 times. Okay, then we will go for in hip flexion, hip extension activated. How to activated? In case both therapists can stabilize the chest. Okay, resist. Okay, trunk flexion. So trunk flexion resist the trunk flexion. So activated the hip extensors. Gluteus muscle activated. Okay, indirectly it's activated at the gluteus hip extensor. Okay. Then you will go for then PNF chopping pattern. Okay, PNF chopping pattern, same, keep on this hand, then trunk forward flexion, okay, forward flexion, then same flexion, D1 pattern, same repetition, then opposite side, D2. Okay. So collaboratively MRP, PNF, then brown stroke. These approaches are helpful for stroke patients. Okay. Then passive movements are basics. Is maintaining the muscle properties. Then stretching also maintaining the muscle elongation. Okay. Then cryo means in this patient spasticity. Okay. The spasticity will induce the muscle tone inhibition. Okay. So you will improve the slow icing. So improve slow icing means proximal to distal. In case muscle flaccid, so that is facilitate technique. This facilitate technique for so distal to proximal, fast icing. Okay. In this case, muscle is the spastic hypertone. So proximal into distal direction, slow icing. So in this slow icing, muscle tone inhibit. Okay. So concept is the spasticity reduced. Okay.